Hey everyone, so I hope you never have to use this video because it is about acute low back pain and how to get some pain relief. The type of pain that if your back gives out, if you have back spasms, or if you're waking up with bad sciatica in the morning, or heck, even at the end of the day from a long day at the office. So guys, I'm Dr. Alex Ritza. I'm a neurostructural chiropractor practicing in downtown Toronto, and today we're going to go over some relief drills that you can use at home or in the office for when you have an acute bout of low back pain. And the caveat that I give for almost every single video is, if you try these exercises and they don't help, that's when you should seek professional advice. But if you are having acute low back pain, if there is pain, if there's something holding you back, there's no caveat here. That's when you should also seek professional help, because acute low back pain reflects that there is a core problem in the spine and likely in the nervous system that should be addressed with the help of a professional. So use these drills to get some relief, to make sure that you're able to get through your day, and when you're able to get in, see us or see another local expert of the spine in your area. So let's get into those drills, guys. So the key with all these drills is to minimize the amount of movement in the low back and progressively add a bit more. If your back's in pain, you're not going to be able to move your legs as far as I am, but you want to make sure you keep that core nice and tight and slowly progress a little bit farther with the knees, bending them outwards. Next, we move on to isolating hip movement. We are on our back and we're just going to do some external rotation, letting that knee fall a little bit farther than you would have in the other drill towards the floor. A nice and controlled motion, nice and slow, making sure to activate the core and the hip muscles we're moving. Then we're going to progress on to allowing both legs to fall. You might get some discomfort at the end range, so do it slowly. As we spread the arms out here to our bent leg rock, the arms open is going to allow us to actually move farther, push more tissues into a place where they might be stretched or compromised. So again, take it easy on this one. Simple knee to chest here. This is going to help to stretch the sciatic nerve, stretch the glutes, and also begin to stretch some of the low back muscles and ligaments. This is a drill that you could start off with in bed. Likely going to feel good as long as you don't have a flexion intolerance. Now, when we bring both legs up, you can rock a little bit back to forth like we've been doing, but I really like to try and hold this one to the chest and really pull those knees as far as you can towards the chest wall before we push things even farther through the low back. With the arms open and the leg crossed, it's going to allow us to introduce even more range of motion into the lumbar spine, into the sacroiliac joints, and even extending up into the thoracic spine. Don't push things as far as I have initially if things are acute, but eventually you want to work towards getting your thigh towards the ground. Similar drill, but we're adding an internal rotation component to this prone internal external drill. This drill is all about control, keeping the core tight, and slowly and controlled move the hip in and out. Next, we're going to move into our thoracic spine. We know that the thoracic spine is going to dictate how the lumbar spine functions, so we want to slowly roll over the muscles of the thoracic spine. And if you're feeling up to it, you can work on extending and bending the individual joints of the thoracic spine backwards over the foam roller. And if you're feeling confident, move down into the lumbar spine with the roller. Next, we're going to do our thoracic cat camel with our with our heels touching our buttock. This is going to reduce the amount of lumbar spine motion so we can slowly work into it. With our heels on our buttock, this is going to isolate the motion mainly to the mid-back or the thoracic spine. And then next, we're going to progress on to a lumbar spine cat camel. And this is where our body weight is actually forward past our hands, and we're isolating almost all of the motion to the low back. You might find this one to be aggravating, so take it easy and slowly again. And then last but not least, this is something I give to almost every single person I see in the office with acute pain. You can do it at the office or on your knees, progressing slowly from small circles out and towards bigger ones, and keep working on these drills until you can see your local spinal professional.